Infectious diseases that are of public health importance in Singapore. The foremost examples of how the causative agent may be transmitted are via air, insects, water, and food. Typhoid fever is caused by the bacterium Salmonella typhi and paratyphoid fever by Salmonella paratyphi. Modes of transmission include direct and indirect contact with patients or carriers, contaminated water and food, raw fruits and vegetables, milk and shellfish. Symptoms of typhoid fever include fever, headache, malaise, enlarged spleen, rose spots on the trunk, constipation, and involvement of the lymph system. Control measures involve sanitary disposal of human excrement, fly control, pasteurization of milk, chlorination of water supplies, shellfish sanitation, and prevention of overcrowded living conditions. Cholera is an acute diarrheal infection caused by Vibrio cholerae. Transmission occurs through ingestion of contaminated food or water, direct contact, contaminated hands and utensils, flies, and raw uncooked seafood. Symptoms include sudden onset of profuse watery stools, occasional vomiting, rapid dehydration, acidosis, and circulatory collapse. Control measures are similar to those for typhoid fever. Tuberculosis is caused by Mycobacterium tuberculosis. Transmission occurs through exposure to bacteria in airborne droplets from the sputum of infected persons, indirect contact through contaminated articles or dust, nasal secretions, and consumption of unpasteurized milk. Symptoms may go unnoticed initially, with tuberculin sensitivity appearing within a few weeks. Control measures include improving poor social conditions, early diagnosis and treatment, pasteurization of milk, vaccination, and good hygiene practices. Malaria is caused by Plasmodium parasites spread through the bites of infected Anopheles mosquitoes. Symptoms include fever, chills, and flu-like illness. Control measures involve preventing mosquito breeding grounds, using insecticides, and protective measures against mosquito bites. Dengue fever is caused by the dengue virus transmitted through the bites of infected Aedes mosquitoes. Symptoms include sudden fever, joint and muscle aches, headache, vomiting, rashes, and bleeding tendencies. Control measures include source reduction, chemical biological control, and elimination of breeding grounds. SARS is caused by the SARS-associated coronavirus transmitted through respiratory droplets and direct contact. Symptoms include fever, cough, shortness of breath, and pneumonia. Control measures involve isolation of infected individuals, contact tracing, and quarantine. Influenza H1N1 is caused by the influenza A virus transmitted through respiratory droplets. Symptoms include fever, cough, sore throat, body aches, and fatigue. Control measures include vaccination, respiratory hygiene, and antiviral medications. COVID-19 is caused by the SARS-CoV-2 virus transmitted through respiratory droplets and contaminated surfaces. Symptoms include fever, cough, shortness of breath, loss of taste or smell, and pneumonia. Control measures include physical distancing, wearing masks, hand hygiene, testing, contact tracing, quarantine, isolation, and vaccination.